A new UNICEF report has revealed that South Africa is one of 20 countries that account for 65% of all children living in severe child food poverty globally. Of particular concern is that 23% of children here in South Africa are classified in that category and are at risk of life-threatening malnutrition, as well as other related health complications. Now, in parts such as the Eastern Cape, insufficient access to nutritious food has also been flagged as one of those factors. Let's now welcome once again UNICEF South Africa representative Christine Muhigana. Christine, thank you so much for being with us. So let's first unpack the report by UNICEF on food poverty in the country, particularly that affecting children.
Thank you, Alicia. Thanks for this opportunity to speak about a very important subject, one that, is very close to our heart. We've been hearing already many months ago about children in Eastern Cape, particularly suffering from severe acute malnutrition. So this report now, which was conducted in actually 100 countries around the world, including South Africa, points to the fact that this is a worldwide issue, an issue that's affecting children in their early ages, from birth to 5 years old is what this report is focusing on, and telling us, as you were saying at the beginning of the report, that at the beginning of this segment, that too many children, including here in South Africa, almost 1 in 4, live in what we call child food poverty, which means that they do not get the diversity and the type of nutritious food that they need to develop fully, both physically and also cognitively.
Let's expand on that. I mean, Christine, why the lack of access to nutritious food? Is it the food costs that keep rising, or what are some of the main areas of concern then? And do you think there's any initiatives or that you are aware of that are in place currently to address these that you can actually elaborate on as UNICEF?
So cost and affordability is clearly one issue in income poor, in poor communities, families. That is an issue. The families, the mother, the caregiver would not be able to afford the kinds of foods that the child needs. But there is also an issue of practices, of behaviors. Even if you do have access to the types of foods that you want to feed your child, you may not necessarily do so because you don't have the practices, the knowledge to do that, and keep doing things that may not be in the best interest of your child in terms of food intake, would be them nutritious or in terms of their health value, or even their quantity. And there's also a whole food system issue, Alicia, the food environment in which we live, because this problem does not only affect families in poor communities or families that are income poor, even those in wealthier environments, in wealthier positions, would not necessarily go for the best, the most nutritious, the most healthy foods, because of the marketing around us that pushes to us ultra processed foods, that pushes to us drinks that are sweetened, which are not necessarily the best for us, and particularly for our younger children. And in this particular report, we're talking about children 0 to 5 years old. We know that in the very early ages, so from birth to 6, they should be breastfed, exclusively. The coverage, or the mothers in this country do not breastfeed as much as is recommended. You would want every mom to breastfeed their child for 6 months. It builds, it strengthens their immunity. And in South Africa, we're only at 50%. So there's that, the first 6 months, and then after that, we are in a situation where 1 in 4 of our children here in South Africa do not get the more than 3, 4, or 5 types of foods that should be fed to children so that they can develop to their fullest. In terms of responses, in terms of what can be done, I mean, first of all, for those who are poor, who don't have the income and could be covered by, some of the social protection systems that exist in this country, but for some reason do not necessarily reach all of them, that should be addressed. The child support grant in this country does not reach all the children, all the kids that are eligible to it. There is the food system that I was talking about. There is actually a draft law in this country that would prevent, some of these aggressive and deceitful, marketing that take place where we are not told, that the sugar content or the actual content or the way, a particular food is made. We should be told that it's not necessarily good for us, and particularly not for our children. And then, and in the case of the case of Eastern Cape comes to mind, where we do unfortunately, have situations where children end up dying of severe acute malnutrition. What we need to do, what we need to have, is a health system that's able to respond to such situations. So the health facility should have the kind of therapeutic food that a child needs when he or she is wasting.
Absolutely.
We should be able to have, community health workers who can, do outreach, be out there in the community to find those children who are wasting.
All right. Thank you so much, Christine. I mean, the junk food industry is currently booming, and we know that affordability is quite a huge concern, particularly in this country, because a lot of people still rely solely on that government grant in order to survive. But thank you so much. Unfortunately, we're out of time. Thank you so much for that input. Christina Muhigana from UNICEF South Africa.